Hi, I'm Abby Lawson. Thank you for attending the Care Coordination presentation. In this session, I will discuss how to develop an incorporated care plan, work with community members and clients to achieve beneficial health outcomes, manage change to guarantee patient happiness, and make decisions in advance that plans have been thoroughly developed. It is also critical to understand how healthcare policy influences patient-centered care. Nursing staff personnel should be educated about care coordination when performing hospital activities. Care coordination is the process through which all care team members, including nurses and physicians, work together to properly plan for the medical dollars allotted in the medical setting to improve customer service and clinical outcomes. To increase positive patient outcomes and attain more excellent healthcare outcomes, the optimal care coordination strategy supports engagement among people concerned, namely consumers, nurses, and patients' relatives. Nurses must ensure patient interest to coordinate care successfully. Communication across interdisciplinary teams and knowledge exchange are critical elements of care coordination. Maintaining an excellent care plan in a clinical setting should monitor happenings, interact with patients to make decisions, and provide specifics for a more efficient and transparent care coordination plan. A suitable care coordination plan must take the patient's requirements into account. To ensure the operational success for specific cancers, for example, the parties concerned must examine the social, interpersonal, and physical variables that affect the patient care rate. Nurses are vital in providing advice on developing and implementing care coordination plans since they are well versed in medical terminology and concepts. Nurses understand their patients' need, the expected amount of time it may take them to rehabilitate depending on their cancer patient, and the emergency medicine measures they must adhere to improve. First, I'd like to discuss collaboration with patients and families for desired outcomes and interaction with families of patients to achieve desired results, then satisfying patient experience through change management. The optimum care coordination approach considers the patient's best interests. The integrated team method is critical to patient-centered treatment and should be acknowledged. As a result, for patients who voice their wants and interests, this system functions flawlessly. Care coordination only addresses the patient's goals. Even if the plan is exclusively for the physicians, it is necessary to include the engagement aspirations of other parties in order to achieve the coordination plan's targeted outcomes. To guarantee practical cooperation and a realistic plan, nurses should evaluate the roles of the parties involved in implementing the collaborative care plan. An integrated treatment plan may incorporate multiple organizations, but the individual and their family's involvement as the proper treatment component should be emphasized. People in the healthcare business who are aware of the client's needs and possess the medical science needed to make judgments about how to implement the objective of the insurance plan should have been among those participating in designing a collaboration plan for clients, for households, and medical workers. As they discuss how to enhance health outcomes, the partnership strengthens these people's beneficial ties. The patient can better understand the condition and the best method to help recover The patient can better understand the condition and the best method to help the patient recover with the help of the nurses and medical personnel. The program's intended purpose and outcomes will be increased using data and recommendation from patients' relatives. Through patient collaboration, medical personnel can gain a deeper understanding of the cultural traits of patients and families, as well as how change affects treatment and care delivery. Cultural issues can be handled by communication between nurses and customers' homes, resulting in a satisfying relationship and a perfect care plan. Patients require care even after they've been discharged from the hospital. Including patients' relatives and loved ones in developing a coordinated care plan is critical. The care plan should lower the cost of therapy for patients to ensure that the intended results are obtained without difficulty. To promote health, the multifunctional team must develop an integrated treatment plan that patients may benefit from after they are discharged from the hospital. Patient satisfaction and experience with the care coordination plan assists patients in recovering entirely, even when recovering at home. An appropriate care plan would help the person both while in the institution and after discharge. According to World Health Organization studies, many patients, particularly those with serious diseases, may not recover or require a long time to recuperate at home after being discharged from the hospital. The inability to recover is due to poor care delivery from the hospital to home-based care. The coordination plan may not function perfectly throughout the transition from hospital-based to home-based care due to the difficulties in reacting to environmental modifications, institutional behaviors, and lifestyle choices. A suitable care integration plan is created to ensure that the patient has a great experience, whether in the institution, at a residence, or in another rehab facility. The plan should be adaptable so sufferers can complete the specified measures at home while achieving desired health outcomes. Effective change management practices should be used to enhance the patient's experiences with the coordinated insurance plan during the transition. Making decisions is part of the plan. After leaving the treatment center, the patient must choose whether one should receive home-based care because they are comfortable with their demands in the surroundings and can get assistance from family members. For example, a patient may decide to have a local community member care for them at home. The second required decision for change management is the financial planning option. Patients have to be able to finance an integrated treatment plan and be free to pick the most suitable one for them according to their economic circumstances. Now I'll cover ethical decision-making in care coordinated plans, effective healthcare policies on patient-centered care, and finally the nurse's vital role in the coordination and continuum of care. To ensure the protection of consumers' data and information, all participants involved in the care management plan must follow HIPAA's ethical principles. No hospital personnel or civic leaders who are not engaged in creating the comprehensive intervention plan should have access to the details provided between the parties. With the development of a case management plan, all patients who require medical treatment, regardless of their culture, are treated similarly. A care plan can efficiently keep and store patients' medical information due to an ethical approach. Ethics must be considered through nurse operations in a healthcare context that attempts to improve patient care and ensure satisfaction, particularly while making decisions. Ethical choices in the healthcare system entail considering several aspects such as hospital performance, patient health, equality, and autonomy. Because it simplifies it to prescribe pharmaceuticals and decreases prescription errors, hospitals must safeguard the confidentiality of patient health care and medical information. On the other hand, nurses and doctors must follow the Healthcare Insurance Portability and Accountability Act's HIPAA regulations and ethical requirements to coordinate patient care. When providing patient-centered care, the patient's interests are considered. When an interdisciplinary care plan is implemented, the participants' interests are prioritized. As a result, the government passes legislation to protect the hospital safety and medical treatments. Because an integrated treatment plan involves exchanging patient health information, policies designed to protect customer records may sometimes have a consequence on the plan. In order to deter medical infractions, nurses and doctors must observe these standards. This conflict significantly impacts how nurses collaborate to ensure the effectiveness of the care coordination strategy. Nurses' productivity suffers due to their inability to communicate healthcare information. Nurses possess the medical knowledge required to comprehend medical symptoms and devise an integrated treatment strategy. While the strategy is being implemented, nurses oversee the professional unit and make medical choices. They collaborate with the facility to oversee the hospital's care and ensure the patient's satisfaction. Nurses select which community and hospital funding can be used to ensure a successfully integrated care plan. Finally, keep in mind the effectiveness of the care coordination plan. Keep in mind that the effectiveness of the care coordination plan will be determined by the patient's requirements and the doctor's capacity for effective participation. Cooperation among some groups will ensure that the coordinated care plan is successfully implemented and that the shared objectives are realized. Thank you.